In the world we live in today, it's crazy that something so small can ruin someone's life in seconds. Good evening, America. My name is Brendan Rosamond, and tonight we will tell you the story of Khaliah Shaw. Mrs. Shaw visited her local doctor in search of a treatment for her oncoming depression, but what she did not expect was her whole life being turned around.
It was a horrifying experience. I was just watching TV in my living room and I looked down to my skin and I saw blisters were breaking out. It felt like I was being burned from the inside out. It felt like I was being drowned in acid.
Hello again, America. Khaliah Shaw was prescribed a drug called lamotrigine, an anticonvulsant that is occasionally used to treat symptoms of depression. After 2 weeks of treatment, Khaliah said, "Oh, I'm fine. Everything's good." Later that day, she screamed in agony as she looked down upon her skin and blisters grew out of nowhere. 911 was called. Shaw was then rushed to the hospital where doctors diagnosed her with Stevens-Johnson syndrome, a rare skin ailment that is caused by sensitivity to a drug taken. This is usually caused by a medication error. Shaw's skin literally melted off as she was covered in blisters. Also, her inner body temperature reached points to where her sweat glands melted under her skin. A once beautiful, flawless woman was morphed into a completely different Mrs. Shaw. Now, we bring you an interview between Miss Shaw and an expert pharmacist, where we can get a more in-depth look into the world of medical errors.
Hello, Miss Shaw.
Hi.
I am a pharmacist. I'm here to interview you.
Okay.
But I'm curious to see what you're doing on your laptop.
Well, currently have a vlog about the syndrome that I have, and I'm trying to raise awareness for it.
Oh, interesting.
Yeah.
Well, with skin burns, they can be pretty treacherous. So, I'm wondering from your point of view how everything's going.
It sucks, obviously, but would you like me to explain the situation?
Yes, explain the situation.
Okay, so I was given the wrong prescription and it messed up my life. The prescription was supposed to be an antidepressant because considering before this ever happened, I was sort of depressed, but instead this medication robbed me of my past beauty. This medication that I was given was lamotrigine, 150 milligrams. Of course, you should know how much that is. It was the correct medication, but little did I know that it was too strong for my body. Months later, here we are, and I'm a very different woman after this slight of attention from the pharmacy.
How unfortunate, especially for your family, and I'm wondering how they're doing, how they're dealing with this.
Before this, I lived by myself, and I've lived my life, but now I live with my mother currently. Due to I need help with certain things because I am slowly but surely losing my eyesight. And I'm still seeing my therapist considering, as I said, that I was depressed before this.
Right.
So now I'm just trying to push through my life and carry on.
So, whose fault do you think this was?
It was prescribing error. The physician prescribed the wrong dosage, and the pharmacist did not catch that it was wrong when he was filling it. He went along with his day while I was doomed with the medication in hand.
Wow. That's, I'm so sorry to hear that one of our faculty members had messed up.
Yeah, it's y'all's fault.
Well, thank you for your time, and I appreciate your feedback.
Now let's take a closer glance at what could have happened inside the pharmacy when Miss Shaw's error occurred.
We think that the medical error was possibly due to overwhelming the employees with receiving hefty amounts of prescriptions on a daily basis.
These slides of mine were the direct cause of prescription error, slipping straight through the hands of the pharmacist, becoming a distribution error as well. The original physician made his first error by prescribing an amount that was too large for his patient, and the pharmacist, probably tired due to the large amount of prescriptions needing to be filled the prescription without questioning it, making this a combination error on account of both medical professions.
Yeah, having overwhelming prescriptions can definitely stress out the pharmacist and increase the amount of error because stress itself is a distraction to the pharmacist.
Yes, yes, yes. I think we really should put a restriction on the total cap amount a pharmacist can potentially fill within that shift. This will cut back on stress and possibly even reduce the potential of error.
Yes, I agree with those points. Making our pharmacists and physicians less stressed will allow for less errors to occur and for less scenarios like Ms. Shaw's to stop being so frequent.
And I also think that pharmacists should make a more thorough checkup of their prescriptions to help enforce like more safe medical practice.
Yeah, prescription should always be double checked to ensure a mistake like this is avoided.
Terrifying story with an educational end. Although it's heartbreaking to see, Ms. Shaw is doing just fine, living her everyday life now, getting along with her disease. I hope all the viewers can take a very serious lesson from this. If you feel weird taking your medications, ask your physician. I'm Brendan Rosamond, and tonight from MCTC 75 Minutes, good night, America.